Hey everyone, it's Mark Weiss. I want to talk today about confidentiality provisions, especially in a contract between a medical group and a hospital. So the prime example would be in an anesthesia contract, a radiology contract, a pathology contract, and so on. An exclusive contract with a hospital, or even better, a system of hospitals. But these days, with more physicians really, in essence, having turned themselves from office-based to hospital-based by way of contracts with the hospital, even those types of arrangements. So this would work for, say, a cardiac surgery group that has some sort of contract with a hospital to function within a hospital's cardiac clinic. So normally when you think of a confidentiality provision, you look at it and you see it as simply a way to protect your confidential information. In other words, your rate information, perhaps some specific staffing information, some of your methods and processes, and you want the other side, in this case the hospital, to hold the confidential information that you share with them confidential. And almost every single hospital contract, at least everyone that I have seen, has a confidentiality provision running the other way. In other words, the hospital thinks that somehow you are going to have their data, and they don't want you sharing that. They don't want you taking that to another facility, say another facility that you serve, that they would argue would make that facility more efficient or a better competitor or whatever. But there's another use, especially for a hospital-based group, for a strong confidentiality provision. And that is that should the hospital turn to an RFP and replace you, in other words, you don't, quote, win the RFP, you've created an additional leverage point for you to attack the RFP process, because it almost goes without saying that the hospital will take your confidential information and will share that in their information, their distributed information that is querying for requests for proposals from other anesthesia groups. If you take a look at reported cases from multiple states, you'll see that many attacks on the RFP process fail. But there are reported cases in which the issue isn't so much the RFP process itself as the breach by the hospital, and then in turn their agents, the consultants they've hired to shepherd the RFP process, of your confidentiality rights. Creates another leverage point for you in connection with potential litigation, and even more so in protecting what truly is your confidential information. So think about it. There are multiple levels on which to view confidentiality provisions. They're absolutely not simply boilerplate.